So nice to be here. Yes, I've been a member of the Interfaith Society for a few years, and been involved with the local committee for Parliament of the World's Religions for that long as well, and had a lovely time in Salt Lake City last month as part of that endeavor as well. I've been working at the University of Alberta Hospital for the last 15 years in spiritual care, is what we currently call it, but it started off as pastoral care, hence the title on the paper there. And I and one of my colleagues spoke with this group 2 or 3 years back, I think, on this topic. So some of what I'm going to say you may have heard before, and that's okay, I hope. And if you've got any questions, don't hesitate to interrupt me. I'm glad for that. But I thought I'd start off, I was going to say that within the healthcare these days, we're kind of in the midst of a lot of, well, turmoil is maybe a nice word, but things are always in flux and in a state of change. And spiritual care has not been outside of that circle of change. And so one of the things that we've been working on over the last dozen or so years does actually have to do with what we call ourselves. And so I've got up here, what's in a name? So I'm going to tell you some things, but partly my intention in telling you these things is actually to hear back from you. I've got some questions for you as well that I'd actually really value your input on, because this is very much in process even as we speak. And so whatever you can tell me by way of just your impressions or understandings will be really, really helpful as I bring forward those kinds of things into some of the conversations that I get to be part of. So I manage a spiritual care team at the University Hospital, and I have done for about 10 years. Prior to that, I was a clinician with mostly transplant patients for 5 years at the university site, and so I've had my hands in that end of things also, and say in management for the last 10 or so years. And so it's more in that capacity where I get to have conversations or be part of conversations about who we are and what we do and how we want to present ourselves so that people best understand what it is we're about. So I've got the name Pastoral Care up there. That's the title that my department was labeled with when I started in 1999. And so my questions are, as you think about that particular term, for you, who do you think needs pastoral care? If you were to hear that term, is that a term that applies to you, or could it apply to you, or would it apply to somebody else? Who needs pastoral care? If thinking here about hospital settings, someone's in a hospital. Who needs pastoral care in a hospital setting?
Everybody.
Okay, everybody?
In some way or form.
Okay, is that what that term evokes, is pastoral care for everyone?
But I think the word pastoral doesn't have the same meaning necessarily for everybody from a different cultural background.
Okay.
And therefore, when they saw the word on the sign, they might say, I wonder what that means.
Okay, all right.
You know.
And some people will throw you out of their room too, right?
Exactly.
Okay, so is there anyone around the table here for whom that term isn't necessarily a positive one or an inclusive one?
It makes me think of shepherds.
Okay, all right, and are you a sheep or?
That might be, I might feel that I'm being treated as a sheep.
Okay, all right,
It seems very Christian too.
okay,
Yes.
I prefer the term pastoral to chaplain. If the pastoral implies that we're walking with the shepherd
okay, all right,
as opposed to the chaplain implies an authority.
okay.
I'd also, as a retired nurse, I'd like to add to the list of who needs pastoral care. I believe staff are very much in.
Okay. All right. That's right, and I am being particular here about the term. I'm not disagreeing with anyone who says everyone needs it. I totally agree with that. My question here is actually about the term, the word that's being used to describe the care that we're implying is needed by everyone.
When you made your introduction, you said, I'm in spiritual care.
We'll get there, John. We will. You're cottoned on to my little scheme here.
But certainly in my experience, families are often the person in the room who needs the pastoral care most,
Sure.
more than the patient.
Yeah. Okay.
Yes, that's true.
That's true.
Okay, and someone
Well,
else?
when I was looking at it, just sitting here and kind of dissociating, first of all, I'm not from a tradition that uses pastoral as a term.
Okay.
So I was looking at the word and it was past oral. So,
Oh,
I thought, so I'm past oral care. I can't be taken care, but that's what you actually do, is oral care.
yes, yeah.
And so it just struck me that was interesting, that the word can be taken apart into.
If you put a hyphen in the middle of it.
Okay.
Yes.
Well, or a
All right,
space.
so-
Yes.
You're
So that's-
past oral care.
That's kind
So
of
what do you
cool.
mean by doing oral care?
Well, oral care would be talking to
Spoken, yeah.
spoken care. So if I'm past the point, but I don't think that's what it's for.
No, it's not, but that's an interesting association.
But it was just something that jumped into my
Okay.
head.
So I just noted that for those of you who caught it sounds a little Christian, that's the pastoral part.
Yes.
People do associate and have in the past associated pastoral care more with Christian faith and Christian delivery people, in fact. So that's my other question. So who delivers pastoral care? Again, first blush response, who delivers pastoral care?
A pastoral.
A pastoral
Pastoral.
type person, okay? Right.
It's the
Okay,
pastoral
and
nest.
so I'll just honor the observation here. In the hospital context, the word that we've typically used in terms of a title for a pastoral caregiver was chaplain. That is the word that typically did get applied. And in fact, we still use that term because we haven't come up with a better one that's as abbreviated as that one is. Okay, so that's the term that started when I started. Then we moved to something different. So we replaced pastoral with spiritual. So now, who needs spiritual care? And does this affect your initial response in any way? Or your first response? Your response to my first query, or the first term. Who needs spiritual care? All of us.
Everyone with a
Okay.
spirit.
Everyone with a spirit. Okay, all right.
What about an atheist who doesn't believe in heaven? There are two chairs. I mean,
Well, if they don't believe in spirituality, then they don't really,
Then maybe not.
they wouldn't
Okay.
perhaps want spiritual.
Okay.
but they might want somebody to check in on them.
Right down the far, I
So,
can't see them.
for me, pastoral care and spiritual care are still two different things, because having a son with special needs, as well as having a father who had a heart attack many years ago, and then he tripped back. One of the things that I find is that someone who just comes in and checks up can be as pastoral, and it doesn't have to be Christian. So I prefer the word chaplain actually, because we've had Muslim chaplains come. We've had Catholic chaplains come. We've had other chaplains come to see who are not of the faith, but who are coming to share. And in some ways that's spirituality as well, but that's been the choice. So in that sense, we have received pastoral care, but we haven't, spirituality's been different because of the Christian spirituality that we share. So in our household, it's been a bit different. We have appreciated the Muslim chaplain who's taken the time to come and see and share, therefore, pastoral care. And so
Although
that's
I'm
been a different.
fairly confident the Muslim chaplain would say that he or she delivers spiritual care. I
Yeah,
suspect.
exactly.
I suspect.
Exactly, that would may have been it. But,
Yeah.
that's not how we necessarily looked at it. We looked
Sure.
at someone who was pastoral, not in the way of, because we've expanded that word.
Sure.
It's the caring for.
Okay.
And yes, out of the Christian tradition, we use the word pastoral care, because that's what we.
So that makes sense to Christians, but it
Yeah.
doesn't necessarily make sense to that Muslim chaplain.
No,
Yeah.
but we can receive it as pastoral care.
Yes, the chaplain
may
can
be-
be pastoral to you.
Exactly, and that's what I'm saying.
When
That's
that
why
makes
the
sense.
word chaplain can be more encompassing than one or the other.
Gotcha, all right.
And does spiritual require perhaps invitation from,
Hmm. And how-
is that a
you
part of
think-
it? Well,
How do you mean?
what, someone had said, well, that you could be kicked out of the room, but
Mhm.
do you have to have an indication of an openness and an invitation? If someone, whoever is a chaplain or whoever, do they perceive an invitation from the person that they come to see? For the,
So, and that's,
yeah.
I mean, that's a fair question, and that's very much a part of a chaplain's work. I'll still use that term for the moment. Is actually determining the level of invitation that does exist in the room for that individual to actually come in and say, hi, my name is Paul, I'm chaplain for this unit, I'm just here to check in on you, see how things are going. That's my shtick, has been. So yes, that's part of the process of actually getting into the room, is to ascertain whether or not that person is even open to that engagement.
Welcoming enough,
Yeah.
which would serve as an invitation
Yeah.
if there's,
Yeah,
if the smile comes or.
something, yeah.
Yeah.
Well, I just wanted to say, being from a very minority community,
Mhm.
and I've been twice at the Misericordia Hospital for surgery and been there for a long time,
Okay.
I found pastorals coming in from different Christian communities,
Mhm.
Muslim coming in. Nobody from my community, because it's a very small community, I didn't even expect that.
Mhm.
I was getting the best care from the doctors and the nurses and everyone.
Mhm.
So it was not so much for me, but for the support of my family
Mhm.
and the people who were there from my family and my friends
Mhm.
who really needed the support. I found one of the pastoral care person, chaplain at the Misericordia, he came around and he was taking care, because there were 4 people in the room. And he came and spoke to one person. 3 of us were different from another thing.
Hmm.
I found some chaplains only coming when the family would go to them and ask them to come.
Okay.
Others they didn't say. This person came around, and he came around to all our beds in our family and talked with everyone and asked if they needed. And that was, I really respected that. So it's a chaplain's duty to see to everybody who is sick in the hospital, and he's like a shepherd taking care of everyone, or is he there just for his own community, you know? That makes it, and especially now when so many people are coming in from other parts of the world. They're not Christians, they're not Muslims, they're not Hindus. They're in a very small margins. So what happens to them?
So the answer to your question, the simple answer to your question is chaplains are intended, hospital chaplains are meant to go to anyone and everyone. That's our training, that's our understanding of self. And that's partly why we like spiritual as opposed to pastoral care, because it does suggest to us at least that that's what our goal is to be able to sort of minister to anyone wherever they're at, regardless
And
of
our
their faith or
chaplains
mission.
encouraged to find out about smaller
Oh,
communities and
absolutely,
stuff.
yeah. Mhm, yeah.
That's good.
And usually the best way to do that is, I won't have studied Zoroastrianism necessarily,
Yeah.
but engaging with
Just
you and your
get
family,
something.
let's say engaging with you and your family, it becomes a
Yeah,
teaching.
just
and-
being humanistic.
Well, exactly, it becomes a
Yes.
learning moment for me when I can ask you or your family members, what's helping you, what's helping you get through this, what brings meaning to this circumstance, where's the hope in this for you, how does your tradition support you? Those are all wonderful learning opportunities for me
Thank
as a
you.
chaplain. Yeah, thank you. Okay, so we've picked this one through a little bit. I've got to keep going, or else you guys are just contributing so nicely here. We'll run out of time. So we've got a new term and spiritual care. So in this department, you can look across Canada, and you'll see actually different terms applied to spiritual care. So pastoral care, the term that was applied almost exclusively was chaplain. For spiritual care, we still have centers that use the term chaplain. We have other centers that use the term provider, and others still that would use the term practitioner. Okay, so those are some of the different terms that you could run across if you're hospitalized in different parts of the country. Now, we've gone from pastoral care to spiritual care. Now we've also, we're considering getting rid of that word. And this is now the cutting edge part. This is news for you here, perhaps. All right, so we've shifted from pastoral to spiritual, and now we've gone from care to health. And now we all get to speak up a little bit more because of the sound system here. So spiritual health is now the term that's being utilized in some parts of our country at least. Actually in quite a few parts of our country already. And the neat thing about spiritual health as I'm experiencing it is that and of course you're well aware that healthcare is a provincial kind of thing, right? It goes province by province, so each province does its own thing. So in BC, they generated a lovely document that looks like this. The Ministry of Health, no less, published a document, you can find this online yourself, that's entitled simply Spiritual Health. And it's a framework for British Columbia's spiritual health professionals. So this is a document that's describing and then detailing who provides spiritual health services within BC's healthcare system. And so you can read all about who it is, what their credentials would be, their training, blah, blah, blah. It's all here, but they use the term spiritual health. As did a slightly older report from the Saskatoon Health Region describes spiritual health. Manitoba has a beautiful piece of legislation. So this is simply a document of the Ministry of Health. In Manitoba, they actually have a piece of legislation that describes spiritual health for all Manitobans, but it's spiritual health, it's not spiritual care. So they're now looking at a concept as opposed to a service or a provider. So spiritual health is the idea, and then the ideal, and spiritual health, I'm just going to throw this word up here, because this is the latest term that I've seen. This comes out of Ontario, where spiritual health, along with a number of other psychosocial practitioner disciplines, has come together to form a college, and they're talking about therapy. So they provide spiritual health therapy. And so they actually call themselves spiritual health therapists. And so I'm going to pick your brains in a moment about that. But what is spiritual health kind of surface for you? Is that a term that surfaces anything else, or brings to mind anything else for you in terms of my questions here? Who needs it and who provides it? Yes, Debbie.
What I like about it is it recognizes that spirituality and spiritual health is as important as physical health.
Yeah.
So if we're going to do the health, I like the health part, recognizing that it's all part of the whole process, and that therefore, particularly in a matter when someone is in the end stages of life, recognize that's sometimes hard, that spiritual health is as important in that time period as physical well-being. So I like the fact that they're using that. If you're looking at it that way, I like that too.
All right.
My bias is that the healthcare system, or people who work within the system, are concerned about the health and well-being of the clients, people living in the community. And so when we use the word spiritual health, for me, it implies that this is not just about what the chaplain does. This is sort of the whole healthcare system, because if you're looking at health, that includes spiritual health, body and soul, exactly.
Okay,
So the integrated piece, and so it's not fragmented then, this person does that and that person does that. It's a team, and in fact, doctors and nurses may be providing spiritual health care as they do. Unfortunately, this public tends to think of the medical system as doing all the fancy stuff. I've been watching the series on CBC lately, and it's been making me crazy because it's focusing on the dramatics in the operating room, etc. And it touches on some of the spiritual things, but it's really in the background as opposed to the drama of the high-tech stuff.
Well, as was noted in one of the sources I've got here, nobody comes to the hospital because they've got a spiritual disease. You don't, right? You're not in the hospital because you're spiritually unwell, typically. Although I would argue that some people with mental health are spiritually unwell, and that is why they're in the hospital. But for the most part, nobody gets admitted to a hospital because of a spiritual disease, or whatever you want to call it. However, as you note, when someone is in the hospital, their spiritual health can be rather crucial to determining all manner of things, how they're coping with their particular circumstance, how long they spend in the hospital can be affected by their level of spiritual health, as you appreciate, I suspect. And so it's being recognized across the country that spiritual health and well-being is a significant factor for people as they are going through a situation of hospitalization and hopefully getting out at the other end. But yeah, people aren't hospitalized because of that typically.
So when you talk about care, you're taking care of, you're addressing an
Okay.
issue. When you talk about health, the implication is that there are states of ill health.
Sure.
And you see, you can give someone care, I think, regardless of whether they are, wherever they are on the spectrum. But to use the word health is putting someone in a specific place on the spectrum, in my feeling. And I don't know, maybe if we wanted to be new age, we could say it's an attitude therapist or an outlook therapist or something like that, because spiritual does turn some people off. I think it's fine, but I know people who think spiritual is almost a dirty word. And health implies that there's ill health, which I know there is, but then you say to yourself, so I don't know. I'm just throwing things out.
Okay.
I think that those are
So
all
it's
things.
a bit more
that-
inclusive, but it's also a little bit more medical almost.
Well, or, yeah,
It
or
could-
implying that you need a chaplain or therapist or whoever it is for your spiritual health, because your spiritual health is in need of being made more healthy.
So there's a judgment there.
Yeah, right.
There's an
right.
implication of a
Right.
judgment.
Right.
You as the spiritual health provider or therapist are coming in with an expectation that the person's spiritual health needs to be
Needs
here.
to be adjusted.
Well,
Yeah,
they may
yeah.
say, what do you mean? I'm
Yeah.
perfectly fine, thank
Yeah.
you very much.
Yeah.
I
So I
just
don't
need
know.
you to walk with me in this
Yeah.
moment. So
Yeah, so it's
there's
just, health has that, implication.
I hadn't thought about the term health before in this connection, but I was just remembering a little over a year ago, sat with my brother-in-law and his wife, my wife's sister, and several members of their family, and we all knew he wasn't going to recover. He was going to die within the next few days. And the word health there doesn't seem to apply in my mind,
Yeah.
because we're all looking at the end of his life, and he has not responded in any way to any of the things that people have done or said to him. He's just out of it. And so I just have some questions in my mind.
So let me tell you a story that reminds me of a story. I won't say I agree or disagree, but I do have a story that comes to mind. As I was with a woman, this was actually quite a few years ago, who had cancer and was on her deathbed. Her siblings were all around her bedside. They'd all traveled from a distance to be with her. And when I got there, it was Sunday morning, 10 o'clock. 3 of her sisters were there, and they were in tears because she'd had a horrible night. Very, very distressed, and she herself wasn't able to communicate any longer. She was breathing hard and seemed to be in pain an awful lot. And these 3 sisters, what can we do? What can we do? We brought hymnals. We've been singing like crazy. She loved to sing them. So we've been singing, doing all these things. It hasn't helped. It had just a terrible night. And I just asked, well, are you waiting for anyone? Is anyone still on their way? And they said, well, yeah, as a matter of fact, our eldest sister is coming. And this was the youngest sister who was on her deathbed, and she was kind of like a mom to her for a time. And so, yeah, we are waiting for her. She's actually, our brother just went to pick her up from the airport. Well, the moment she walked through the door, this woman, whom everyone had said was comatose, in pain, da-da-da-da-da, all these things, the moment she walked through the door, the older sister, the patient's breathing slowed. Everything got less stressful. Her sister went right to the bedside and said, "Anne, I'm here," and everything just kind of went like that. It was beautiful to see. They got to sing, they cried, they told stories, and within an hour she died. Which for me is an example of a spiritual, healthy kind of situation. Even with someone who was, it seemed at least, incapable of engaging. It was beautiful to watch her actually mouthing the words as we were singing. She was right with us, yeah, there was something kind of neat. So yeah, simply a story. I found a lovely quote here, and I'll actually make this available to those who are interested. Along the lines of spiritual health, Václav Havel has written a little comment here on hope. Hope is not the same as optimism. Hope is not the conviction that something will turn out well, like this, when obviously it can't turn out well. But hope is the certainty that something makes sense, regardless of how it turns out. And I've been mulling on that a little bit, that something makes sense, regardless of how it turns out. Which, for me, as a spiritual care provider, suggests a measure of engagement with some ideas and just with a circumstance.
You suggested there, with your said turned out well, and you said where it didn't turn out well because the person died. I take exception to that. Because part of the business of pastoral care, and for all healthcare providers, in my view, it's written in our code of ethics, is that we're there for a healthy or a peaceful death. So there is such a thing as a healthy death, even though it's the end of life.
Yeah, that's right. And my use of the term "well" there would be more along the lines of it didn't turn out the way you would necessarily have wanted it to turn out. So thank you for that corrective. But that's, say, most people don't want their loved one to die deep down.
Of course we do.
Yeah, so they
say
it turned out in a way that they might not have
for
wanted.
a healthy
Oh,
death.
totally, absolutely.
I mean, not just the truth.
Yeah, and that was,
And-
yeah, so that was the point of my example of that, was exactly that. So thanks for that corrective there.
Can you just read that one
I
more
think
time?
that the word chaplain carries a connotation as well in the general public, who assume that it means something to do with religion. And
That's why I said
spiritual
that
health
before.
care is not necessarily dealing with any specific religion. So I keep wondering, when you mentioned there's Muslim chaplains and there's Christian chaplains, you know, we're making a religious connotation to it, and I understood that chaplains are supposed to serve all people regardless of their religious background, but that's not the public expectation in general. I don't think they assume that.
So and that's partly why we're trying to sort of steer away from the term chaplain, because it does tend to be misused, number one, and then misunderstood, number two. And even using the term Muslim chaplain, a better way to understand it, I suspect, is a chaplain who is a Muslim. I'm a chaplain who is a Christian. Because everyone who's got training as a chaplain, we'll get to the training in a minute here, actually has to be engaged in a meaningful way with some faith tradition of some sort. That's fundamental to being a spiritual health provider, is that you've got some kind of engagement with a spiritual tradition, whatever that tradition is. Yes, but
Well, I just wanted to be clear that spiritual could also connotate religion, but I think everybody is spiritual. And I think that we need to sort of help in some way to recognize that people have a spirit.
yeah.
Well, we
So-
believe that, but everybody
Not
doesn't
everybody
believe
believes
that.
they
I
have a
know.
spirit.
But more
But I
people
think
believe that
we need to be-
than the religious part. So I think that's been our experience, at least thus far, is that spiritual tends to be a term that's more acceptable to more people than would be pastoral, because that's,
Yes.
okay, so we haven't come up with a better term that's inclusive of absolutely everyone. So if you come up with something, Karen, let me know. Because,
Be a human, I guess.
okay, so and someone asked for that quote again. So here's a quote from Václav Havel: "Hope is definitely not the same thing as optimism." Sorry, hope is definitely not the same thing as optimism. Hope is, it's not the conviction that something will turn out well, but the certainty that something makes sense regardless of how it turns out. Okay, so not the expectation that things will turn out well, but the certainty that something makes sense regardless of how it turns out.
so that life has meaning, basically.
Yeah, yeah.
That's how I see it.
Yeah. So, okay, well, thank you very much for your input here. This has been instructive to me. Confirms and challenges a few things that I've been wondering about or thinking about. So just a bit more information then. Within healthcare, those of you who are familiar with the healthcare system will have heard of regulated and non-regulated, or mostly probably regulated healthcare professionals. Spiritual care is a non-regulated healthcare profession. And so that means that we're not treated exactly the same as everyone else. So we're not in legislation any place that limits or describes what our role is, what our scope of practice or anything like that. And so that can be an advantage, but it isn't necessarily. So that's just a little factoid. Spiritual health, and however you want to envision this for yourself, whatever makes the most sense, is getting onto the radar across North America, in fact. So in the States, they have this lovely piece of legislation that stipulates what everyone can expect in healthcare wherever they receive it in the United States, and spiritual care is part of that. They don't line out exactly how it's to be delivered, but that you should be able to expect some spiritual care of some sort, or some nurturance of your spiritual health, however you want to understand it, is in their legislation nationwide. So they do have ways of sort of measuring, I guess, whether or not that's taking place. We don't have that across Canada so much, other than, as I say, in Manitoba, where it is actually enshrined in a piece of legislation. However, from the States, we in the AHS were privileged to engage with a Dr. Bridget Duffy last year, and she shared some interesting, to me, information relative to my topic or my field of primary interest. So she described in the course of her presentation on sort of improvements in quality in healthcare, what she called 5 always events. And if you Google this, I suspect you'll get this someplace, always events in healthcare. And so she named 5 of them. In reverse order, the last one she stated was create consistent, seamless journeys. So everybody gets can expect the same quality of care and the same kind of path through the care system. Engage patients and families in their plan of care. Seems like a bit of a no-brainer, but it's written down because obviously it doesn't happen all the time. Third one, improve physician-nurse communication. If you are a nurse, you'll appreciate, I suspect, the wisdom in this particular statement.
Clarify, this is between doctor and nurse?
Yes.
Okay.
Yes, okay. Fourth, to put doctors and nurse back at the bedside instead of in meetings or writing endlessly or whatever. And then fifthly, in my list, first on her list, was address patients' emotional and spiritual needs. So 5 always events, the first thing that she wrote on her list was address patients' spiritual and emotional needs, which I thought was kind of a neat thing to see on a list that was being presented to AHS leadership across the province. She also noted some, and I think this was American research, that indicated that 73% of people who are in a hospital indicate that they have spiritual needs of some sort when they're in the hospital. 73%. And only 6% of those said that those needs had been directly addressed while they were in the hospital.
Oh, really?
So 3/4 of people have some needs that they would label as spiritual, and less than 10% say those needs were addressed in any meaningful way.
Wow.
So that's a huge discrepancy. Okay, so that's just a little bit of information for you. Time-wise, we are moving along. Okay. So I want to just share one last little piece here, and that because some of you may be familiar with the training process for spiritual health practitioners, therapists, whatever we're going to call them, remains to be seen yet here in Alberta Health Services. But it's called Clinical Pastoral Education, which we shorten up like this. We just call it CPE. So Clinical Pastoral Education. I'll just point out that's the neatest my handwriting's been for a long time, so enjoy the ability to read it, because it's not usually like that. But, so clinical pastoral education is something that has traditionally been delivered within healthcare systems across Canada and much of the United States. So, and in Alberta that has been the case. Clinical pastoral education has been happening at my site, University of Alberta Hospital, since the late 1970s. Delivered by people who were paid by the health system to be chaplains or chaplain educators. And these students then would be going on to either a ministry track within their faith tradition, and back then it was almost exclusively Christians going into Christian ministries, or they would be moving into some kind of institutional service as spiritual health providers or therapists or whatever you want to call them. But the training was provided by and within healthcare. So when I started in 1999 within Alberta Health Services, there were probably about 8 or so, at least 7 people employed by the healthcare system, Alberta Health Services now, to do this training. They were employed full-time to teach CPE students, so teach people skills and self-awareness that pertains to spiritual care. Since 1999, that number has been whittled down, and as of about 3 years ago, that number went from, then it was about 5 or 6, and now it's 1. And
Wow.
so that has meant, obviously, a dramatic reduction in the numbers of students, number 1, and number 2, just the whole process of how this happens has changed rather dramatically as well. And so I'm happy to report, in light of these changes, that Alberta Health Services has been very supportive of creating something new to deliver this training. And so a consortium of theological colleges, and at this point they're all Christian theological colleges, but a consortium of colleges and healthcare providers or systems. So AHS, Covenant Health, and Bethany Care Group at this point are the ones that have sort of signed on in unofficial ways, at least, to this training consortium, such that the clinical training, the clinical experience that's necessary for the training can take place in any of those different contexts. We're also working to have that training made available in prison contexts, so that can be another learning environment for prospective spiritual health practitioners. But that's all moving ahead slowly, but hopefully positively. And in 2 or 3 years' time, I trust that something good and solid will have been pulled together such that the training can go forward and is going forward in a consistent and predictable way. Yes, John?
Is the training provided individually for the persons who apply, or do you collect a group and have a class
So, good question.
somewhere?
Good question from a professor there, just wondering about the logistics of things. So yeah, CPE is actually kind of it's a different learning modality than a classroom setting or a one-to-one preceptor kind of setting. CPE has always been delivered in a small group context. So that small group consists of between 3 and 6 learners who do clinical work as part of their training. So they go and visit with patients and they do their thing with patients. And then half of their learning, that comprises half of their learning time. The other half of their learning time is more standard classroom sort of stuff, like training about how to get into a room, how to introduce yourself, how to ask for that permission to get into a patient's sort of personal space. And also training about bereavement support and various psychological theories and all those kinds of things that one needs to know in order to actually do the work. But also, and this is the sort of what I think, and I haven't found anybody else who does this, so I'll say unique part, is that that group of students also spends quite a lot of time learning with and from each other by means of their clinical experiences. So if I'm a student, I've been with patients the last week, I'm charged with the task of actually writing up one of my interventions. I have to write a verbatim, essentially, about my time with the patient. And then I bring that verbatim to the group, and the group then, and as part of that, I'm writing out sort of not just what happened, but why I said what I said, what I think happened for the patient, did I notice any changes, improvements, shifts, whatever, did the person kick me out of the room, whatever, right, anything that, and why, those kinds of reflective pieces as well. So then my student peers spend the next hour and a half picking my intervention apart. And asking me, why did you say that? And what was going on for you as this person was saying this? They broke into tears, and you say you quickly handed them a Kleenex. Why did you do that? And how did it go? What happened? Right? So we do that. And then another part is and this I think is, so other disciplines do that sort of thing. So they'll record, they'll audio, videotape, whatever, and they'll all watch, and then they'll do this kind of thing as well. The truly unique piece is a piece that we call interpersonal relations, where the group of learners just sits together with no particular agenda for the day and basically talks with one another about anything that's come up within them in the course of a week. And so, for example, for me when I was a student, suicide was a challenge. I'd had some experiences with other people, and so I was in a place where suicide patients, victims, came through fairly frequently, and I was struggling with that. And so as part of this IPR, my fellow learners would check in with me from time to time about how this is going, and they would push sometimes. You know, in that last verbatim you said this, and you said you're going to do something differently. Is that going? How are you doing with that? Anyway, they would push quite hard, actually.
That's good.
And so it's, I suppose, a bit like, sort of like group therapy, but it wasn't therapy per se. It was learning, and it was that challenge to really integrate and claim my who I am, what I'm doing, and just be really, really grounded in that. So that's part of the learning modality that I haven't experienced or heard about from other disciplines and happening even in a similar way. So it is a very different kind of learning modality. It works really well for a lot of people. It really doesn't work for some, and that's okay.
One
But
curious
yes.
thing that you failed to mention in your learning experience is the varieties of religious beliefs that affect a person. And so if they don't understand the difference between a progressive Christian or an evangelical Christian or a Muslim and a Zoroastrian as something that they have to cope with, are they getting any kind of background about that position that might affect the person?
Yeah, there's, sort of general awareness and learning about different faith traditions is part of the training.
Okay.
But I think a more significant part of the training is to learn how to engage with any one of those people in such a way that they can help me better understand how their particular worldview, whatever it is informing their health experience or their illness experience, right? So that for me is the spiritual part. Religion is a way of speaking about spiritual things, and so what's your language, right? Help me understand your particular language in speaking about these things that are really quite common to all of us.
Do they do training on end-of-life decisions?
That can be part of it, yes. Yeah.
Because to me, that's to negotiate not just the patient but the family.
Yeah.
in that
It's more sort of advocacy is what we end up doing. It's not so much saying
For
this
the
is
patient.
for the patient. Yeah. Mm-hmm. Yeah. Sorry, there's a comment.
I'm
go ahead.
intrigued by your style of operating with 3 or 4 students, and you sort of the center of the discussion there, because it's the exact opposite of what I took 55 years ago in pastoral counseling.
Okay.
Where we had to interview someone every week and write up that interview and then turn it into teaching assistant, so that It's just a difference of style, I
Yeah,
think.
yeah.
Maybe yours is better, I'm not sure.
Well, it's certainly more, it's challenging, because not everyone appreciates having a group of people that you may or may not entirely trust coming at you with pretty challenging questions sometimes.
Question, right. You were talking about the fact that there's less training and there seem to be less folks entering into the program. Did I understand that correctly? So there are less spiritual health providers, chaplains, whatever.
There are fewer trainers, so
Trainers.
that means there are fewer trainees, yes.
Because one of the things from a personal, my son was just in, day surgery turned into whatever. But when we got to the PICU, it was fascinating. And before he was even into the intensive care unit, the social worker asked if I wanted to see a chaplain.
Mm-hmm.
And by the time he was in, within an hour and a half, maybe 2 hours tops, a chaplain came to introduce herself, which was very different from a year and a half ago when he spent 11 days in the Stollery, 30 days in the Glenrose, or 12 days, 30 days, and 11 days, and we never saw a single chaplain, even though we had asked to see. So I found it fascinating because what I realized after that particular, stepping at it from not just a parent perspective, but also from the clergy perspective, saying, this is why my congregation constantly says we need to see you, because I experienced it from two very different, but I realized it was the social worker. Somehow the social worker, without having any idea about my child, she was the social worker to the PICU, not having any idea about my personal spiritual or religious background, but coming to say, would you like this? And then having somebody actually show up an hour and a half, 2 hours later was powerful, but to realize that that person was the intermediary and that we did not experience any of that in the 8 weeks he had been hospitalized.
What is PICU?
Pediatric intensive care unit.
Oh, okay.
Yeah.
Sorry.
Yeah.
It's not that he hasn't been for a long time, but
Yeah.
but
No, I
it was
just didn't
interesting.
know what the reference
But
was.
yeah, it was the social worker who was the catalyst. And even though we'd asked for it several times in the other time period, it never happened. And yet here we have, and I have no idea what her spiritual background is, what her religious background is, but it was obviously on her radar. These are the things that you need to ask. And so she followed through, and the chaplain followed through.
Super, good.
It was
Thank you.
phenomenal.
Yeah, Bruno.
For me, pastoral care and also, it's from my experience, I found the ethical issues that you're dealing with in healthcare and the families and patients are being faced with are really become pastoral issues. To what extent are pastoral care people involved in those kinds of situations, and how do you work with because I know hospitals now have bioethics teams, etc.
Yeah, so that's one of the very interesting things that's kind of evolved over the last 5 or so decades, is that certainly in smaller centers anyways, it's not unusual to find the single chaplain who's on site to be the chair of the site ethics committee. That isn't unusual.
Wow.
Across Canada anyways. And it's not because we have any specific training in biomedical ethics necessarily, but more, I think, because faith traditions tend to train us to think in a values-based way. So we think about things and we ask ourselves, how does that relate or reflect on my values, what I think is important or meaningful? Whereas society generally doesn't tend necessarily, doesn't think in that way quite so rigorously, I guess. But being part of a faith tradition, that tends to be part of the discourse. When one gathers with one's faith community relatively regularly, values tends to be part of that. And so you're trained about hope, you're trained about love, you're trained about responsibility and utility and stewardship and all these kinds of things. These are terms that you do get exposed to in the course of your personal formation and whatever your faith tradition is. So it is a more natural part of what a spiritual health provider does engage people about. Is kind of like, not only how are you doing, Mrs. Smith, does it hurt, and how are you doing with that, but let's think about your whole plan of care. And the doctor I just heard said this, they want to do this procedure, or they're recommending that course of treatment. What do you think about that? How does that fit in with your values, essentially? I mean, that then becomes an ethical conversation that others don't necessarily go to quite so naturally, in my experience anyways. And so yes, I think spiritual health providers tend to do that sort of thing. They engage that because that's kind of the world out of which we come. And that's in part, I think, why, as I mentioned earlier, to be a spiritual health provider, you need to be grounded in some faith community. Doesn't matter what, but some faith community. And so with that grounding, that's part of what you grow up with, or you grow into, is a sense of that ability to ask those kinds of questions just as a matter of course, right? How does this reflect on your values? What does this mean to you? What does this mean for you?
One final thing for me, what about then a chaplain who has been asked to be involved with a family, with a patient, and the patient is ready to just say, I'm done, my life is finished, and the family is, and the chaplain sees things differently because of their own spiritual background or their own religious background. Do they then recuse themselves? Or do they continue in such a way that because there's a bond in some cases now developed. And there's this sense that the patient and the chaplain, there's still that, I want to provide spiritual care, but what this is now happening, it goes against what I believe. And so
I'll just...
Or with the minister and the chaplain, like having run into this, I ministered at a deathbed, and a chaplain came in and goes, what, we're not doing this anymore? And it's like, excuse me? We've just walked our way through this journey to this stage, and all of a sudden someone comes in and wants to turn it all around and throws the whole family off, and the family's not going, well, maybe we've jumped the gun. And it's really hard then to sit there and say, okay, because now this is a difficult time. So how does that work?
So just to, my immediate response to that is it's never the chaplain's job to impose his or her beliefs on anybody else's course of treatment. Again, being rooted in my faith tradition, I know what my response might be. I have a sense of what that might be in the circumstance. And so I can then ask myself, well, what does that mean? How do I get to that belief? Where does that come from? And then I can I can take that and wonder with you and the family about how you're responding to those same kinds of questions. That should be my response in that circumstance, if I'm doing my job well. Okay, so I wouldn't recuse myself. I might say at some point, boy, you guys are sure going at this in a different way than I've become used to, and I'm appreciating the opportunity to have my boundaries stretched here, or something like that. I might say something like that, just so that I'm being honest with them, that I'm finding it difficult. But that shouldn't be enough to say, okay, no, I can't deal with you because you're going in a totally different direction than I think you should be. And in fact, more often the case, it tends to be that people are wanting treatment to be prolonged in ways that the healthcare system, at least, and maybe even I as a chaplain, think aren't particularly healthy or helpful. And so inviting people to think about what's going on in that light. But again, doing that in such ways that I'm not perceived as imposing my opinion or attitude. And certainly I've been asked lots of times, what would you do? And I'm sure lots of other health professionals get that same question. Well, if this were your loved one, what would you do?
It is a true situation that we just went through last year, where the person had cognitively very aware, made the decision that he was ready, and doctor, family, and we did the whole, and then I come back a day later, and the chaplain's been to visit, and all of a sudden everything's turned upside down and on its head, and it's like, shit, we just, you know, this was such a hard time. The man lingered for another 3 weeks.
Yeah.
And it was devastating for everybody to just witness.
Yeah, so let me tell you another story just to end, because we need to wrap up. I think we could probably go on for some time, but just to honor your time. One more story though, in this line. I was called to the bedside of a woman who was described as being kind of difficult. She wasn't accepting of the plan of care that the medical team wanted her to take. I was told that she had a cancer that was very treatable, and she was refusing treatment. And so they thought, before they called psychiatry, they would try the chaplain. Great. So I go in, and this woman introduced herself and was quite happy to engage with me. She did identify herself. She said, you know, I've got my own spiritual path, thank you very much. And I said, okay, that's great. I'd like to learn more about that. So, and I don't have the details in my memory anymore, but the general details were such that she had been born and raised in a Eastern European country, and there had crossed paths with a particular spiritual leader whose teaching, as I recall her describing it, had to do with the ability of one's own mind and will to heal oneself. And so that, she said, I've been practicing this for my whole adult life. It's always carried me when I needed it. And the teaching also involved not confounding that process with unnatural things like Western medication, for example. So she was quite actively and consciously refusing any chemotherapy, any radiation therapy. She just said, no, I will do this my own way, according to my own spiritual practices and beliefs. Mm-hmm. So I, as a chaplain, got to then ask her more about that, and discovered that it was something that, it was a realm of a practice and belief. I wasn't familiar with it, but I learned about it. And determined with her help that she was very much wanting to pursue this and was really not going to accept anything else by way of treatment. Thank you very much. And so it became my happy task to advocate on her behalf with not only the healthcare team, but also her two young adult children who thought their mother was crazy. For their understanding of what the doctors had told them and the prognosis and the treatment plan, all that sort of stuff, he said, Mom, just do this and you'll be better. And she said, no, thank you. So that became part of my task with her, was to simply convey her wishes, engage with her children, engage with the care team, and eventually she was discharged, and she had to sign all kinds of things saying she declined treatment, blah, 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 and I think psych had to come in and make sure she wasn't impaired in her judgment, so they had to sign off on that, but she did get out of the hospital, and she went her own way. I didn't ever hear what happened to her, and never saw her name in the obituary, so maybe it worked, I don't know. But
Maybe
that.
they just didn't put an ad in.
Pardon me?
Maybe they just put
Maybe they didn't, who knows?
Yeah.
Anyways, but that's one of my memories of engaging with someone whose beliefs were new to me. I didn't necessarily agree with them, but they were her deeply held beliefs, and it would have gone against her own integrity as a person, for me to advocate anything differently, for her to receive anything differently, and so it felt really good for me to be able to be part of her care in that capacity, just simply advocating for someone who definitely wanted things in a particular way that differed from what everyone else thought was best. So I'm going to wrap up with that because our time is at an end.
I just want to say I like
Yes.
practitioner better than therapist.
Okay.
Because therapist implies that you are doing therapy.
Yes, it does.
And from what you've explained
Mhm.
that you do, it sounds more like you're a practitioner than a
Okay.
therapist.
Okay, thank you. Yeah.
Thank